Hi guys, this is Dr. Sharon Arbel, licensed clinical psychologist, and I'm here to talk to you about autism spectrum disorder. So I got a lot of feedback after the dyslexia video, and some of you wanted to know about autism, so I thought I'd talk about that today. Autism is a developmental disability. That means it affects a child's development, and it also is something that we diagnose or we notice in the early developmental period. Some of the hallmarks of autism are difficulties in social communication. So meaning it can be a verbal communication, like carrying on a conversation, initiating greetings, responding to greetings, or it can be things that are nonverbal, like eye contact and gestures, body language, personal space, and understanding all those variations of nonverbal language. And then also the other component of social communication and interaction is understanding relationships, being able to be, first of all, being interested in peers, being interested in other people, wanting to be around them, knowing how to interact with them and how to maintain those interactions, maintaining friendships. So those kinds of things are hallmarks of the social communication aspect or deficit of autism. And then the other main area that people with autism struggle with is repetitive or stereotyped behaviors. So this might be repetitive behaviors like arm flapping or, finger twisting, things like that, flicking on and off the lights, just staring at wheels spinning of a car rather than really playing with it. But it might also be, just in that rigid, inflexible adherence to certain routines. So rituals are really big here. Children or people with autism have a hard time straying away from things being done a particular way, having a hard time with transitions, and a really hard time if those rituals get broken. Some fixated interests we see in this area too. So these are interests that are either abnormal because of their focus or abnormal because they're so intense. So I've worked with many children in the past who say are very interested in elevators and talk to their peers about elevators and know all the details about how elevators work, and that's not a common childhood interest. So we want to know, what it is that they're focusing on. And then it could be a normal, a typical interest, but it's so intense that, they lose people. Like they have a hard time understanding that not everybody wants to know about this topic over and over again. In this category, we also see things like echolalia, which is that parrot-like repetition. So the way that the voice is used is, exactly like a parrot would repeat back in the same tone of voice and the same volume. We see some of that repetition. We see, a lot of distress around changes in rituals. And this makes it really difficult for children to function like this. Also in this area, we see a hyper or hypoactivity to sensory input. So kids are either overstimulated by sensory input and having a really hard time with certain textures, certain sounds, certain smells, and we'll literally see, kids kind of covering their ears or, just being really sensitive to sensory input. Or on the flip side, really seeking it out. So needing a lot of contact, rough contact, body pressure, needing a lot of that stimulation. Having an indifference to pain or temperature. This is all kind of stuff that we see in this area. A lot of times I get asked about Asperger's. Asperger's is no longer something, it's not a diagnosable condition. It is something, so in the DSM, which is kind of the psychologist's Bible, in 2013, the criteria changed and there's no longer Asperger's disorder. So children who have Asperger's disorder are now being diagnosed with autism spectrum, or there's a new diagnosis, and this is where some children who don't really fall into autism spectrum will be diagnosed with social communication pragmatic disorder. And this is where we see that difficulty with verbal interaction, with social communication, the verbal and the nonverbal aspects of communication, but we don't see those repetitive stereotyped behaviors and movements. So that's really how the two, it's kind of a simplistic way of looking at how the two differ. And but we don't talk about Asperger's anymore. It's all called autism spectrum, and for children who have those social communication difficulty but don't meet the criteria for autism, then they might fall into this new category. So a lot of kids with autism have some other behavioral difficulty. We see a lot of tantrums with kids with autism, so if you can think about it, that makes total sense. There's a language delay, and it's really frustrating when you can't communicate, when you can't express your needs. And so we have a lot of tantrums because kids are very frustrated being unable to express themselves. Some self-injurious behaviors, and that really relates to not just the internal frustration, but also the sensory issues that I discussed previously. We see a lot of anxiety with kids with autism. This is really related to those routines and that rigidity, that the sameness is very comforting to people managing autism. And so when you break that sameness, when you break those routines, they get really distressed, and we see a lot of anxiety come up. Almost like in OCD, very similar type of anxiety. Also, hyperactivity and impulsivity and inattention are really common with kids with autism. So we see that occurring it's comorbid issues that occur concurrently with autism spectrum. And then because of the sensory sensitivity that I talked about, a lot of times we see eating difficulties. So kids who are very, very picky eaters and, are very restricted to specific categories of foods or specific brands of foods and specific textures, and just have a very extreme reaction to some new foods. And then sometimes we see comorbid concurrent mental retardation. So that's just kind of a little bit of what it looks like. There's actually, a lot of times, because of the movie Rain Man, really, a lot of times people think, oh, well, autistic individuals, they're geniuses. There's that concept of the autistic savant, but it's actually only about 10% of people managing autism have savant abilities. Now that's a lot more than the non-autistic population, where we see like 1% savant. But still, it's only 10%. And the reason for that is thought that the autistic brain is much better at picking up details. And so we have some, really developed brains who are looking at the details that non-autistic brains are unable to pick up on as easily. All right, so the brains of autistic individuals are different than non-autistic individuals. So the structures actually look different, and it's also functionally different. They function differently. And now I'm kind of getting into the causes. So definitely there's a genetic component there. It's not figured out completely. We know a lot more now than we did before, but researchers haven't nailed down a cause. And then there is environmental causes. There's some hypotheses about prenatal environment and postnatal environment that might contribute to this disorder. There is the very popular vaccine cause, or the vaccine hypothesis, which I'm not going to get into because it's just it's one of those things that is, it's still being researched. The current research does not support a link. The vast majority of the research does not support a link, but it's something that is always being researched. And so those are kind of the things that are, being looked at in terms of causes of autism. Autism is a lot more common in boys, and kind of the overall rate is like 1 in 68, but a lot more common in boys than it is girls. Probably about four more times in boys, 4 times as often in boys than in girls. So with autism, what's really important is a good assessment and early intervention. So a good assessment is not just going to look at a child and saying, oh, he has autism. There's a gold standard in testing where there are specific tests that have to be given, a battery of tests, really a very thorough neuropsych battery of tests that looks at everything from intelligence to brain processing and specific autism assessments, and that leads to a very thorough diagnosis. And then really after the diagnosis is where parents need the most amount of help. So after the diagnosis, you got to get intervention. And there's a lot of intervention out there for kids with autism. Lots of different therapies. There is speech therapy and floor time and occupational therapy, applied behavior analysis, medications, dietary changes, lots of different things. And there's a lot of options for parents, which is really great, but it can also be really confusing. I will tell you that the most widely researched and supported intervention is applied behavior analysis, and that is also known as behavior modification. That's been researched for the last 40 years, and at this point it's something that insurance will cover kind of in parity with other medical conditions. So if a psychologist or a doctor prescribes 40 hours of this therapy per week, the insurance will cover it. So after the diagnosis, it's really about moving to insurance to cover services and to get really good quality services. What we know about intervention is that there's a very critical period of time, usually when the child is under 5 and just the brain is much more malleable and plastic and capable of making significant change. And so we like to see kids getting an early diagnosis so that they're getting early intervention. I am not a big supporter of the wait and see philosophy. I think if your child is showing some delays in speech, some delays in nonverbal language and social interaction, it's time to get them evaluated. And actually assessment now occurs as young as 18 months. Actually, in some research universities as young as 12 months, but in kind of common testing practices, we can test kids as young as 18 months and reliably diagnose them. So I'm not a big proponent of the wait and see philosophy. I think if you're noticing some significant delays, there's a lot of resources out there. The regional center will cover, therapies for children with developmental delays up to age 3, and after age 3, it really goes over to the insurance if a child has a diagnosis of autism, and really the regional center becomes the last resort. But the school district will also help out. So there's legislation from 1997 called FAPE, Free and Appropriate Education, where the school district is mandated to offer free education in the least restrictive environment for children managing autism and provide them with therapies and accommodations on school grounds. And that's for children 3 through 21. So it's not just if you're in the school system. Even if you have a preschooler, they can get services through the school district. So there's a lot of services out there. There are many agencies and many professionals serving children with autism. But it really is about knowing what's out there and getting the right support and getting the right, sometimes legal assistance. You know, it's hard to navigate all those systems, the school district, the regional center, you know, there's other systems out there to navigate, and I think sometimes you need to get legal assistance. And then the other aspect after the diagnosis is to get support for the family. So there's very high levels of marital stress in families of children managing autism, and I think that speaks for itself. It's a very stressful experience for parents, and that affects the couple, the marital relationship. And it's hard on the family. It's hard for siblings to, you know, have a brother or sister with autism. That's a difficult experience, and those individuals all need support. So it's really about getting the right intervention for the family, because when the family is better supported, then the child with autism is better supported. And actually the research shows us that the intervention works better. So when the parents are taken care of, the marital relationship is on its feet and is doing better, the intervention for the child will work better too. So it's really about looking at the whole picture and getting support, not just for the child with autism, but for the whole family. All right, I think that wraps it up for today. Please feel free to message me with questions or contact me. I do work a lot with autism in my practice, and I'm happy to answer any questions. And please share this video, because knowledge is power, you know, as cliche as it sounds. And I'll see you guys soon.